Hi, I'm Dr. Smith, and today's topic is going to be about arm and hand numbness, tingling, and pain, and the causes of it. And today we have a guest with us, one of my patients too, who's going to describe to you some of the things that he went through with my treatments and in the past. So you get a real live testimonial. I have some notes that I wanted to review with you here, and so I'll be referring to them. The numbness and tingling and the pain relates often to something called a peripheral nerve compression. That means nerves not here in the central by the spine, but in the various areas, muscles, tendons, ligaments, and so forth down the arm like that. Thoracic outlet syndrome is an example of that. Carpal tunnel syndrome is an example of that. In the 35 years of practice, I have found most arm and hand numbness, tingling pain is due to compression of primarily two categories. One of them is through the spine, and the other one is through this peripheral nerve entrapment. In these injuries that we get that lead to this can be sudden, for example, an auto accident or a fall, or they can be a gradual process or a combination of both of those. A gradual process would be like throwing the baseball hundreds of times, developing tightness in certain muscles that then affect the nerves. Another example could be like squeezing garden shears many times, affecting the wrist and forearm, and then experiencing the symptoms down into the hand. Or painting overhead, where you're using your shoulder and your forearm, creating what we call a crush type of occurrence upon the nerves going through the muscles. First, what happens with these injuries is tissues are going to swell and be painful, first stage. The second is then the blood flow, almost simultaneously, will begin to become more congested, and the area will be congested. There's something called lymph, which is just the drainage back to the heart. So the trouble is the body can't always keep up with that swelling, and so the area will stay swollen. Next is the scarring of the tissue will begin. That's the repair. And next, then you notice more and more stiffening that becomes long-term, restricted movements. And fifth on my list would be adhesions. That's the scar tissue now forming, it's like sticking the muscles or the ligaments or tendons, the various injured tissues together to mend them. But it can stick them to nerves. You can stick joints to ligaments and so forth in ways that are not appropriate for good range of motion and good nerve function. So, just kind of summarize, we get scars and stiffness and pain in the muscles and tendons and in the joints. And then what happens is we get adhesions between the various muscles, joints, ligaments, and now it's called a peripheral nerve entrapment. Some examples of, we start off with thoracic outlet. That's where the muscles into this area here and here are going to get tight and compress upon the nerves. Another example would be something called peroneus, or the oh boy, we blew it. Can we like go back?